All right, Kinesiology 121. This is Steve Barnett. Steve, would you like to introduce yourself and what you do?
Sure, I am. My name is Steve Barnett. I'm a physical therapist at Orthopedic and Spine Therapy.
Steve. Now you have clinics all over Northeast Wisconsin, correct?
We do. We actually, not only northeastern Wisconsin, there's 17 clinics in total,
Okay.
and 5 we've got up in the northwestern portion of
Okay.
the state, and then the remaining 12 are in the northeast portion of Wisconsin.
Okay. Well, I guess my first question is, what do you define physical therapy as?
When I think of physical therapy, even especially our clinics and our therapists, I look at us as being musculoskeletal experts. In other words, people come to us with any type of musculoskeletal issues. We are very good at diagnosing them as well as treating them according to the restrictions that they show.
I have heard multiple definitions related to rehab science. Would that be another way to define physical therapy?
It could be. I haven't thought of it or heard of it in those terms, but yes, yeah. Very much looking at best ways of getting that person back to their daily activities and their most normal activities for their daily life, yes.
So, I don't mean to go into more personal, but what made you decide to go this route for your career, I guess?
Yeah, good question. In fact, I even prepared for this one. Usually it is something that people will ask
Yep.
me, but so I was at another school at Drake University in Iowa. That's where I started out at in college, and I was all over the board. Yeah, I was business, I was geology, I was stats, looking at different majors, and it was my first semester, my sophomore year. My mom and I were talking over the phone, and was down in school, and she said, "Have you ever thought of physical therapy?" And I had not. She was going to see a physical therapist at that point in time, and like any dutiful son, I looked into it further. I did look at schools in Wisconsin, since that's where I'm from originally, and made an appointment to visit with the dean at Marquette University. Had that appointment, and soon after applied, and next year I was in the physical therapy program.
Was that 6 years? Well, did you have your basic bachelor's of science?
So, good question. At that point in time, no. I was a year and a half into schooling.
Okay.
I took a semester off. Marquette recommended that just take that next semester off and then start anew with them. So I ended up then going for 3 more years at Marquette.
Okay.
Back when I graduated, which was then 1983 from college, it was a Bachelor of Science. So Marquette specifically was a 4-year program. You were accepted in as a freshman into the PT program. And then it was 4 years of schooling to complete your degree. 1990 it went to a Master of Science degree with 5 years, and in 2000 it became a doctorate program, which most universities now have doctorate programs, so it's a 6-year program.
So I suppose the kind of schooling, does kinesiology, is that a pretty broad type of degree that you can branch out in becoming a skeletal expert, or can you become a physical therapist with other degrees?
Yeah, you can. Yeah, for instance, now you do, if I'm not mistaken, you do major or have an emphasis in a few different fields, whether it be kinesiology, whether it's I'm not exactly familiar with what route they're taking now, but very much so, where they then have that as a sort of undergrad emphasis before then going on to physical therapy for their doctorate degree.
Would you say Bachelor's of Science is probably the most common one?
Yes.
Okay.
Yes.
Was it, on a scale of 1 to 10, how would you rate the difficulty of the schooling?
I've always felt I've been a good student. There's a couple courses that sort of kicked my butt. Physics was one, but even neuroscience was another one. I remember going through my studies at Marquette. They were tough courses. The teachers were very good, but I was able to make it through. I thought the rest of it was good, especially more so as we got into the application of the physical therapy classes in the program itself.
So in other words, you don't really have time to slack off?
No. That was a good question. I was also I was a runner at the point in time. That's what brought me to Drake. And so when I transferred, I was still on the cross country team and track team at Marquette. But it became such where classes were pretty much full day. So I still ran, but not on the teams anymore. I didn't have because the practices interceded with classes, and so. There was, again, making up for that semester I lost too. There was times I was taking 18, even one semester I took 21 credits, so it was pretty intense.
Yeah, that's a lot. I got 18 right now. So.
You know what I mean?
Oh, yeah. Going through the schooling, did you have, like, hands-on experiences? Like, did you work with corpses or?
One of our classes we did was called gross anatomy, and so we learned in class the anatomical structures, but then we also went down to lab that had where we worked on cadavers, people who had volunteered their bodies after their death to the Marquette University to their physical therapy and dental program. So we worked pretty much on the lower body from the neck on down, where the dental students then utilized the cadavers for the head on up. So that was very valuable, and in subsequent years I've had the opportunity to take other coursework in that, and especially after being out in practice and then seeing the anatomical models up close, the real bodies up close, has been very rewarding and even more beneficial to my career.
So if the opportunity ever arises, would you highly recommend taking it?
Very much so.
Very much.
Yeah, they had that traveling circuit, traveling exposition, Body Works. I'm not sure if you'd heard about that, and it was a company that took cadavers and brought their bodies down to the point where you just see muscles and the skeletal system, but they were in various poses. And I had seen that a couple times as well over the past 12 years. Again, just fascinating. But now I'm able to apply those even more so in my career. When as a student, it was a little bit difficult because you're learning and information overload at that point in time. But now that I'm in the physical therapy world and working with patients day after day after day, and then seeing the body up close in this manner has been very beneficial. So by all means, if the class is available, I highly recommend close-up anatomy class in that realm.
So I understand there are other skills such as dry needling that are other certifications that you have to receive. Besides dry needling, is there any other special skills you can acquire becoming a physical therapist?
Yeah, so we call dry needling is a modality, as we would term it, meaning it's something that you would apply to the body. We've got other modalities like ultrasound or hot pack, e-stim, iontophoresis. Now those you don't need the certification for. Dry needling is very new to the profession, more so since the early 2000s, and it become more so over the last few years where they're highly sought after classes. That is one that, at least the direction that I took, as well as I had our therapists go through, we did go through a certification program. There is other certifications within physical therapy. would be orthopedic certifications, get certifications in cardiac rehab and sports medicine as well. So people can branch off into more of a specialty if they so desire, or get certifications in specialties.
One thing I'd like to clear up is an acupuncture different from dry needling?
It is.
It is.
Yeah, it's many times it's utilizing the same device. When we're doing dry needling, our goal is to alleviate the presence of trigger points that are in muscles. And so the way we practice, we don't leave a needle in, but we do go after the trigger points in the muscles, and in efforts to alleviate those. I'm not an acupuncturist, and I've never attended an acupuncturist course, but my impression is that they are doing, their intent of their practice is different than what ours is, yes.
Do most people who start PT school end up finishing successfully, or what's the graduation rate? Would you?
Yeah, when I went to Marquette, again, I was a transfer student into the program, and I believe that year I was one of 7 people who had transferred in. And so we were admitted into a program that started the sophomore year, since our freshman years were considered to be taken care of in our previous schoolings. And by that time, or by the time that we graduated, there was 57 therapists, some 57 people who had graduated. If I'm not mistaken, they had accepted 80 into the program initially. 70 to 80 people. So there was probably about 25 people, close to 30 people who either did not successfully make it through the program or decided at that point in time through their first 4 years that physical therapy wasn't for them, and they decided not to continue that route.
So you'd probably say anywhere between 60, 65%?
Probably at that point in time, yes.
With the cost of PT school, I understand it's going up and it's not going to go back down. Do you think it pays in the long run?
Yeah, it's definitely been a rewarding career. I do have some issue with the way our profession and our supporting cast has maybe not helped us out in that realm. Again, when I went through schooling, it was a 4-year program, and now kids are going through it takes them 6 years. What's unfortunate, especially in more the private practice, is the way that we are reimbursed for our services is different than the way therapy is reimbursed in the hospital systems. For instance, we will get reimbursed maybe, for example, $85 a visit. That same visit in the hospital, maybe $150 to $200 they'll be reimbursed. And it's the way the insurance has written up the contract for whether it be private practices or for hospitals. So that's a little limiting with regards to the salaries that can thus be paid out to therapists. We, as private practice, try to maintain the same salary structure as would be a hospital for a therapist. Obviously, it puts a little bit more difficulty on our part. We have to make sure other margins are very thin with regards to our expenditures, because our most valuable asset is physical therapists.
Yep.
I feel that we should be paid more for what we do, not only because of the cost of schooling and the loans that come out. We have some folks on our staff who, it's not abnormal for them to have 6-figure loans coming out of school, and the salary's not necessarily keeping up with it to make those loans easy to be made payable, as well as then afford a new car if need be down the road, or a house, etc. I feel that the APTA, they're the ones who really made that push for our master's and then to our doctorate. And I think there should be a little bit more efforts too in helping reimbursement levels be of such where salaries can also be elevated and raised to meet that.
So in other words, you would say there needs to be work done with the insurance companies as far as reimbursement for private practices?
That would be very nice, as well as even for hospitals where they do get reimbursed more, to recognize that, hey, our therapists have gone to schooling, they've got a very good knowledge base. They really should be the first line of entry. If someone has an orthopedic musculoskeletal injury or issue, they should actually go see a good physical therapist first before going to see necessarily their primary care doctor or an orthopedic surgeon, because they're not necessarily ready for surgery unless it's a traumatic injury or something that's known to need that right away, surgery right away. But if it's an ankle sprain, knee sprain, or overuse injury at the elbow, they should be seeing a physical therapy first. The therapist can diagnose what's wrong, find those restrictions, and treat. Incur less insurance costs as opposed to have to go to maybe a GP, have x-rays and labs, and then send them on to the PT. Okay, but time will work out. It's been a very rewarding career. I wouldn't change anything at all for it. I feel that, especially the therapists that we have working with us feel that same way.
I guess one final question I would address is, if somebody wanted to branch out of kinesiology, is there a different path? I do remember in the past you mentioned somebody had a degree in engineering and still became a physical therapist. Is it possible to become a physical therapist in more broad spectrum of degrees other than kinesiology?
Oh, sure. In fact, I've, one of our therapists, he was in the military, was a nuclear engineer. And Todd then, after his military career, went back to school and became a physical therapist. I know some who have gone the attorney route and went back, got their degree in physical therapy. So, obviously you've got that one degree under, if you were to go back into physical therapy, they'd probably take a look at you and say, all right, you've got all these elective courses under, the undergrad courses all taken care of. Now we're just going to get you right into the graduate program, where it's going to be the sciences and specific physical therapy courses.
All right, well, that's all I got for today. So I appreciate your time and
Thank you.
Yep.
Appreciate it.
Yep.